Hi, welcome to the Brain Injury Answers podcast. This is Dr. David Glazer providing the answers you need when a brain injury occurs. This podcast is for educational purposes only. For treatment, please consult your physician. This podcast does not represent the Department of Veterans Affairs. All right, let's get started. Question: what is this feeding tube the doctors want to put into my loved one who recently had a traumatic brain injury? Another great question. Oftentimes, there are negative connotations and ideas surrounding a feeding tube. But in many cases, when it comes to proper treatment of a patient with a brain injury, the placement of a feeding tube is very, very, very important. See, what happens with a person who has had a brain injury is that the body needs a lot of nutrients, a lot of protein, a lot of calories. It's almost as if a person went and ran a marathon and now needs to eat a lot to make up for all the calories that were burnt. But in this case, the body is trying to heal itself. The brain is trying to heal itself. And it needs nutrients, and it needs protein, and it needs calories to properly heal. The longer a patient does not receive the proper nutrients to live and heal, the longer and harder the recovery will be. So, in many cases, it is very important to have a feeding tube placed. Oftentimes, initially, you may see a feeding tube be threaded through someone's nose and all the way down to the stomach. But as time continues on, and it seems as if the patient will not be able to eat on his or her own, a more permanent tube needs to be placed. And this is done by putting a tube through the stomach wall, kind of above one's belly button, and inserted directly into one's stomach. If a patient is having a lot of nausea and vomiting and trouble handling the feeding, then this feeding tube can often be placed past the stomach. So the nutrients therefore go past the stomach and enter around all the intestines and body parts that the stomach flows into. There are many different names for a feeding tube. You may hear a percutaneous gastrostomy tube. You may just hear a gastrostomy tube. You may hear a nasogastric tube. And there are a lot of other initials and names. But they all basically stand for the same thing. Putting a tube through a body part to get the food to the stomach and intestinal area. Once a feeding tube is in, there's often a little bit of a wait time before one can have the food run through it. This is so that parts of the skin can heal around it. Once this healing is done, food is then either put through a little bit of a machine to pump the proper food into the feeding tube and into the stomach, or sometimes it's just a matter of taking something that looks like formula, which may be in a box or a can, and just pour it down into the tube. Technically, one could even put ice cream down the tube, but oftentimes ice cream does not serve much of a nutritious purpose. It's mainly just a lot of sugar, and it tastes really good. But at this point in time, if someone's receiving food and nutrition through their feeding tube, one doesn't want to put food in their mouth, especially ice cream. You need very, very nutritious food. And that's why the patient will be working with a dietitian to maximize the right food and formula for the patient. As time goes on, hopefully the patient will start developing their swallowing muscles, and they'll work with their speech and language pathologist to develop their nutrition and swallowing skills and their chewing skills. These techniques for chewing and swallowing are meant for a different episode, because that in and of itself is a major field of study and can take a long time to explain. But as one continues and learns how to eat on their own again, you will often have something called a calorie count performed to see how much the person can eat on their own without food being put through the feeding tube. Once a person is meeting all their calorie and nutrition needs through their mouth, and at least 6 weeks has passed since the placement of the feeding tube, the doctor will then think about taking out the feeding tube. In most situations, it takes no more than 10 to 15 seconds to take out the feeding tube. Oftentimes what is done is the patient's asked to not eat from about midnight the night before. Or you just say don't eat once you go to sleep, and when you wake up in the morning, hold off on breakfast for a little bit of time. Then the doctor, or at least what I do, is then remove the feeding tube first thing in the morning, because you don't want a patient to have to go hungry for too long. So with that, I generally will go into a room and I'll have some alcohol pads and some towels and some gauze and some tape, and I'll tell the patient to take a deep breath, and I tell them you may feel a little bit of a punch into your stomach, but it will go away, and you don't need to be put asleep for this. And I then take hold of the feeding tube, and I give a hard pull, and the feeding tube then comes out. In most cases, there is very, very, very little bleeding. There could be some stomach juices that come through this hole, but that will stop within a few minutes generally. I then patch up the hole with some Vaseline, some gauze, after cleaning it well with alcohol and with some saline. And then usually within a couple weeks or so, that hole heals up. So that's the whole story about a feeding tube. In generalities, every patient's unique and every patient's different, and every doctor you work with is different. But know that the feeding tube is very important. And when it comes time for a conversation about a feeding tube being placed, be open to hearing and learning more about a feeding tube and the importance of it being placed. Here's to good nutrition. That's a wrap for today. Remember to email all your questions to braininjuryanswers@gmail.com. Check out the website www.braininjuryanswers.com. Thanks for listening.